Thank you, everyone. Welcome to the October 4th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnan.
Austin Magnan is present.
Bill Muller.
Bill Muller here.
Jennifer Maynard.
Jen Maynard here.
All right, then staff and anticipated speakers, if there are any on the agenda, when I call your name, please respond in the affirmative. I know Nancy is not going to make the meeting this evening. Colleen Boland from the Alliance.
Colleen's here. Good evening, everyone.
Evening. And then looks like Danielle Edmonds is also here from the Alliance.
Here.
Welcome. Thank you, everyone. I'd like to open the meeting. Can I get a motion to open?
Yeah, this is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
I second that.
All right, and then all in favor?
Aye.
Oop.
Dan Finn, aye.
Bill Muller, aye.
Austin Magnan, aye.
Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, thank you. Good evening once again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act that's extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until April 1st, 2022 of the remote meeting provisions of Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted on the town's website, www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you're broadcasting on your screen could be captured by the recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public's encouraged to follow along using the posted agenda. Before we turn to the first item on the agenda, allow me to cover some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. If there are any speakers for any of the topics for the agenda, I'll introduce them. After there have been any remarks that they've concluded, I'll ask if any board members have any questions or comments or motions. Please remember to mute your phone or computer when you're not speaking. And then, of course, please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any responses, please wait until I, the chair, yield the floor and then state your name before speaking. And then if any members wish to engage with any other members, please do so through me, the chair, taking care to identify yourself. And then if there are any votes to be taken during this evening's meeting, they'll be conducted by roll call vote. I noticed there was a quick comment. Looks like we have also Shane Kevel Wagner, I hope I pronounced that right, from the Region 2 HMCC on also. Thank you, Shane, for letting us know that. All right, so I think all that being said, we can turn to our first topic, which is the Alliance updates. So I don't know if Colleen, Danielle, who's gonna kick us off.
Danielle,
Colleen,
you want
go first?
Huh?
I can go first.
Yeah, go for it.
Perfect. Okay. So I sent over my inspection list, Karen. I don't know if you had an opportunity to send that over to the board. But that indicates the inspections that were completed since the last meeting. And then it has a list of the updates and complaints that the office received. And we really only received one complaint, non-COVID related. But I addressed that with an on-site inspection, spoke with the person in charge, and we were able to kind of figure out what was causing that issue, and it was remediated. So does anyone on the board have any questions?
Dan?
Danielle, this is Dan. Just one quick one. That was the South Grafton location? Of the Cumberland Farms?
That was the Cumberland's on Main Street, so I believe so, yes.
That would be South Grafton. Okay, thank you.
Any other questions on that, board members?
Nope.
Right.
All right, so I will start with my update. I know Shane and Pam Masters, they are our two new emergency preparedness team members. So they are trying to join as normal people like we are as a square. So I just resent them the link. So hopefully they'll be able to get on, and we thought they could just introduce themselves to you. They'll be reaching out throughout the year regarding emergency planning, response, EDS plan. So hopefully they're able to get on and be able to introduce themselves.
They're still having trouble. I'll see if there's anything I can do on my end.
Yeah, it's strange because when Shane texted in the chat that he was on, you couldn't see a square for him, which was very weird. Oh, here he is. Now I see Shane.
Yeah, I'm sorry about that. I joined with the webinar ID and password, so it brought me in as just to view the actual meeting.
Gotcha.
So I think Pam's having a similar problem, so she should be on shortly.
All right. So I'll start with the other updates, and then Pam and Shane can introduce themselves and tell you a little bit about them. So nothing too earth-shattering since our last meeting in terms of update. The weekly update did go out, I think probably around lunchtime today. So hopefully you guys got that. It was a little late going out.
Yeah, Nancy forwarded it over to us.
Perfect. Okay. So a couple things to note that we've found has been confusing for residents that are calling into the city. And I tried to make the distinction on the monthly update, the difference between a booster shot and a third dose. And I can't remember if we talked about this at the last meeting. So I don't want to repeat myself if we did, but I don't believe the booster shot was approved yet. Okay. So we've gotten a lot of folks that are confused and frustrated regarding the difference between a third dose and a booster shot. And there are folks that technically don't qualify for a booster shot, but they do for a third dose, and which sounds crazy, but it's the technicality of the definition of each. So I wanted to just talk through those with all of you really quickly, because we've had a lot of confusion on this. So as of the end of September 24th, the Pfizer COVID-19 booster shot was approved. So it went through the whole long approval process with the FDA, with the CDC, trickles down then to Mass DPH. And so as of September 24th, individuals who received just the Pfizer vaccine and that are either 65 years of age and older, or individuals between 18 and 64 that are at risk of severe COVID-19 due to underlying medical conditions, and the CDC has a whole list of them. Individuals that are between 18 and 64 who are at an increased risk for COVID-19 because of their occupation or institutional setting that they're in. Those categories of folks. So again, it's you got Pfizer for your first 2 doses, you're 65 plus, or you're between 18 and 64 and have a certain underlying medical condition that puts you at severe risk, or you work in a setting that could put you at an increased risk, you are eligible to receive what they're calling a booster dose of the Pfizer vaccine for extra protection and an extra immune response. There are currently over like 400 and I think the state said 460 locations in the state, a lot of the pharmacies in particular, that are offering the booster. In addition to that, the state's actively working with local health departments or regional collaboratives like ourselves to be able to support us in offering boosters as well. So there's a lot of conversation this week we're having internally about the booster rollout and how we can utilize vaccine and support booster rollout, especially in certain more at-risk populations, right? Like for our senior centers in particular. So there's definitely a lot more to come regarding, as an alliance, how we're going to be supporting the booster shot rollout. That being said, folks could also go to any number of pharmacies and get it as well. The third dose, which was approved back in August, I believe, the third dose is for Moderna or Pfizer. So if you received the Moderna vaccine or the Pfizer vaccine, and again, you meet certain criteria, and these criteria are pretty specific in terms of a medical condition that you may have. So you're actively in cancer treatment, you've gotten an organ transplant, you have advanced or untreated HIV infection. And again, the CDC lists it out. If you meet that criteria, you can get what they're calling a third dose, and you are eligible for if you received Pfizer or Moderna. So we had an individual call the city to say she was very upset that she was not, she was told she was not eligible, I think, for the booster shot. And she called us, she's very upset. Walgreens rejected her for the booster shot. And when our nurses talked to her, they said, well, ma'am, yes, you're not eligible for the booster, but you're eligible for a third dose. So in many ways, they're one in the same, but the federal government and the state have a very clear distinction. We have been telling folks, and if you're hearing questions or the office is getting a lot of calls, we encourage folks to call and let our public health nurses know. Our nurses can help talk through the distinction between the two, or to also call your primary care provider. Although we're finding a lot of primary care providers say, oh, call your local board of health. So it sometimes the call to your primary care works, sometimes it doesn't. And not everyone has a primary care physician or one that they're comfortable calling. But certainly we've received a lot of questions. So if you are as well, you're hearing a lot of questions regarding that, please don't hesitate to have folks call us in Worcester, and we can help talk anybody through that, one of the nurses. In addition to that, the state is starting to work on a potential rollout plan for when the Pfizer vaccine is approved for 5 to 11-year-olds. So we don't know exactly when that's going to happen, but the state's already in the process of trying to assess, again, where's there going to be access for that. And so we actually today filled out a survey, from Mass DPH internally about if we would be interested in helping with the rollout for children and what our capacity was. So we filled that out on behalf of the Alliance, that yes, we are willing and able to support the rollout for the pediatric population once it becomes available. It's unclear where those outlets are going to be and to what extent pediatricians' offices are going to play into that. We in the city are a regional depot for COVID vaccine, and we right now don't have any pediatric practices, I don't believe, that are using us as their depot to get vaccine. I know personally, I called my kid's pediatrician's office to say, hey, I haven't gotten any information yet on flu clinics, because they get their flu shots at the pediatrician's office. I haven't gotten any information. And the response was that they were so incredibly short-staffed, they were not offering clinics. And so unless you were 2 years old or younger, you would not be able to get your child a flu shot at the pediatrician's office, at my pediatrician's office. So it's unclear the capacity that local offices will have to be able to help support the rollout for pediatric population. But that's exactly what the state's assessing right now. So we're filling out as local public health, the survey, physicians' offices are as well, and other providers. So much more to come. And as we know more on that, we will share that with all of you. Another piece of information that came out since our last meeting, the DESE commissioner extended the school masking requirement. So that will now be at least through November 1st. So before it was through October, they've pushed it out a month through November. So that was an update since our last meeting. The last probably 2 updates regarding masking. Since we last met, the Worcester Board of Health ratified emergency orders that were signed by our medical director, Dr. Hirsch. The Worcester Board of Health met last Monday. They ratified those emergency orders to require masking in all indoor spaces, to also ensure that businesses report positive cases of employees to our office, and to also mandate masking for all schools. In addition to that, West Boylston had already done it, which I think we mentioned at the last meeting. And the Shrewsbury Board of Health has a special Board of Health meeting scheduled for tomorrow to discuss any type of masking mandate as well. So more to come after that, but they do have a meeting tomorrow in Shrewsbury for that. Any questions on COVID before I move on to just a couple other highlights?
Dan, looks like.
Yep, thanks, Colleen. Getting back for a second to the booster and 3rd shot. Correct me if I'm wrong, but I think it has to be 6 months since the 2nd shot on each of those.
For the booster, and I don't want to screw this up, I believe the booster is 6 months. I'm looking if Pat put that specifically in her. She did. The Pfizer booster administered minimally at
Right.
6 months post dose 2.
Correct.
However, the 3rd dose, I believe, can be within 28 days after your 2nd dose.
Oh, okay.
And to note, there is still no booster or 3rd dose approved for the J&J vaccine.
Second dose, yeah.
This is just for Moderna and Pfizer.
Right, thank you.
All right, a couple other quick things to note regarding arbovirus. Worcester and Shrewsbury have caught up to Grafton and are now also at moderate risk, but certainly a much, knock on wood, quieter season, especially with EEE. They say EEE typically is cyclical, right? And it's kind of 3 years on and then it dies away for a little while and then comes back. So this would have been our 3rd year, but it seems to have been pretty quiet statewide regarding EEE. In addition to that, the Regional Youth Health Survey, the goal is that the surveys will be administered electronically to reduce paper, electronically in November or December. Our team and the community health office is still working internally and with UMass. It's the UMass Prevention Resource Center, I think is what they're called, PRC. They help us do the analysis, clean up all the data and do the analysis of it. So they're aiming for November or December, but that's certainly subject to change due to COVID. We certainly understand that superintendents have a lot going on in their schools right now, and we don't want this to be an extra burden, right? We want to make sure that we're respectful of everything else that's happening right now with the pandemic, but certainly more to come on that as we know for sure. Lastly, I know we had talked last meeting about having our tobacco control inspector come to this meeting and give just an update and a little background for any newer folks on tobacco control. She's unexpectedly out of the office for a month or so. When she comes back, hopefully in November, we'll make sure we get her on an agenda so that she can give you more information on that. Any questions for me on anything I discussed or anything I didn't discuss? All right, let's see. I think Shane is on, and let's see. Pam, I see Pam's name, so I think Pam's on too. Shane and Pam, do you want to just both introduce yourselves and give a little bit of background in what you're going to be doing at DPH?
Absolutely. So my name is Shane. I just started with the city back in July, so still fairly new, kind of figuring everything out. My background is in emergency planning, and most recently I worked at the Southern Worcester County Regional Vaccine Clinic in Uxbridge. We administered around 23,000 doses. So I know I kind of understand your world. You guys are crazy right now. It's definitely an interesting time to be in public health. That being said, on the HMCC, specifically the FEP side of things, in emergency preparedness, we're still expecting to meet all of our grant deliverables that were outlined previously. So you should expect to hear from Jamie Terry for SNS drills and the AARIP, and Forrest Price for the for his planning, the EDS. Alyssa wanted us to check in with you because I think typically she does the reporting on WebEOC on behalf of Grafton as a part of the alliance. So she wanted me to double check and make sure that you guys are still okay with that. And remind you that MRC volunteers are available to you. Like I said, I know you guys are crazy. So whether it's in a clinical setting or really any capacity you can utilize the volunteers, reach out to Lois or any of the HMCC staff. I know I'm kind of jumping all over the place here, but I also want to take a moment to introduce Michael Nelson. He's not on the call today, but he joins the HMCC as a Mass DPH OPUM sponsoring org representative. So we're really excited. I think it's going to be a good year, and we're gonna get through this COVID craziness. But we're here for all of your emergency preparedness needs. So feel free to reach out to us. Our next FEP meeting is actually going to be October 7th. So it's this Thursday at 9 o'clock at Red Apple Farm in Phillipston, if any of you guys would like to join. I know I kind of just stampeded over Pam. So Pam, if you'd like to take a moment to introduce yourself or cover anything I didn't.
I'm not even sure if y'all can hear me. Are you able to hear anything?
She might be having trouble. I'm not sure.
I can barely hear.
Can you hear anything at all?
Can hear you a little better now.
Barely.
Yeah, the connection is absolutely miserable, and I'm even trying my own personal laptop because my work one just was not doing anything with the video, and neither is this. And I'm not sure if it's Zoom or if it's my connection here at my house. But I'm the new program manager, and I was living in Georgia for about 10 years, doing public health and healthcare preparedness and running a coalition. But all of my family is here, and my parents are approaching 80, and I have a 3-year-old grandson. So I've moved home to be closer to family, but I am really excited to be able to continue doing the work I was doing in Georgia because I absolutely loved it. So if there's anything that you need from us, please don't hesitate to reach out. Even if there are technical difficulties, we will figure it out. Thank you.
Thanks, Pam and Shane. We're very excited to have them on board. Alyssa was an emergency preparedness office of one for quite a while. So it's nice to get some relief for Alyssa and get a couple other folks on board. So you'll certainly be hearing from Pam and Shane throughout the year, the grant year. The last thing that I will say is we are very sad but excited for Danielle. This is her last meeting. It's her last week with us. She'll be moving on to a new position outside the city starting next week, but we've thoroughly enjoyed having Danielle with us over the past couple of years, be able to work with her and all the community. So thank you, Danielle, for always covering these meetings and passing on the torch to me. I will continue to cover the meetings. And certainly, Julie or Micah for the foreseeable future will be your points of contact covering Grafton while we look to our next steps with Danielle's departure. But thank you, Danielle, for all of your hard work over the past couple of years.
Thank you so much, Colleen. And again, I'm really gonna miss Grafton, especially. I really do, love this community and love all members of it. So really, thank you so much for this opportunity, and hopefully, I'll see you guys soon.
Thank you, Danielle. We
Thank you, Danielle.
appreciate everything that you've done and all of your assistance over the past couple of years, and we will miss you too.
And good luck.
Yes. All right. If there's nothing else on the Alliance side, then I think we can jump over to the next topic. Thanks everyone, Shane, Pam. Feel free to, obviously, if you want to stay on, same thing, Colleen, Danielle. But if you have somewhere else you need to be, then by all means. Thanks again for everything and your updates and your ongoing work in the lovely world of COVID and non-COVID side of things. So next topic is COVID. I'm not going to reiterate some of what Colleen already said, but to go over our usual, the first kind of subtopic is the data that we have from a case count, et cetera, and then any variants that are out there. Of course, right now, the big one still is Delta at this point. That hasn't gone anywhere yet. As of today, Grafton's been informed of a total of 1,362 confirmed positive cases since we began case tracking back earlier in 2020. A big watch out is that number of new cases is continuing to still be on the higher level than it was prior to Delta showing up. So that's whether it be Grafton, surrounding communities, the state, the country, the globe, honestly. At this point, that hasn't gone anywhere yet. Some days, I will say, when I see the numbers on a daily basis, some days there's only 2 cases. Some days we've seen it where there's still 8. So it's not like we're getting back down to a definite low level amount of cases at this point. So we're still in it for, I'd say, the foreseeable future. Worcester County and the surrounding areas are still considered to be high risk per the CDC's classification methods. With that elevated risk continues the CDC advisory that all individuals wear face masks when they're indoors in public places, regardless of vaccination status. And all of that being said, the board continues to strongly advise individuals to take and exercise precautions, be mask wearing, social distancing, frequent hand washing, monitoring of any symptoms you may have. I know people personally who have said, it's allergy season, now it's cold season, it's going to be flu season. It's that tricky time of year again, where if you have the sniffles, is that simply your annual allergies? Could it be something more than your annual allergies? So we're getting to that tricky time frame again where we don't necessarily, you can't just say it's my allergies and move on, because it may be something more than just allergies. Or possibly a cold. So we all have to continue our precautions with the fact that COVID is still here, and it's going to be here for who knows how long at this point. From a vaccination efforts perspective, once again, the board continues to strongly recommend that all individuals who are eligible and able to get vaccinated, please do get vaccinated. I'm not going to reiterate everything Colleen just went over around 3rd doses for certain immunocompromised populations, or boosters now for certain populations, specifically to Pfizer, where she did a great job at covering all of that. I guess before we jump to anything around mitigation efforts, any questions or comments from the board members regarding either the case counts, vaccination? All right, seeing nothing. All righty, so mitigation efforts. This is around, and Colleen did touch on this a little bit, around the board wanting to revisit potentially discussing the mandates that Worcester had put in place, similar mandates. I know we started discussing this a little bit. At that time, there were only 2 of the mandates. that Worcester put in place. So just a reminder for the three of them that Colleen touched on. One of them is the mandatory reporting of positive COVID cases by businesses. That used to be part of the state level requirements, but then that had gotten rescinded. The next one is mandatory masking for all students and employees. And it's for all public, parochial, charter, and private schools. As we know from a public school perspective, you do have the DESE requirements that, as Colleen mentioned, just got extended till at least November 1st. And then the third one is the one we didn't discuss really last meeting because Worcester hadn't had that one fully in play yet, is the mandatory masking at indoor spaces open to the public. I know the last meeting this had been tabled. The discussion was brief and then we tabled it, but we said we would put it back on for this meeting. So with that, I just wanted to open it back up to the board members for further discussion as we said we would. Dan, looks like.
Sure. You know, I still think we have to watch our immediate town numbers, and in general, they're not as scary, I don't think, as other parts of the state and maybe even Worcester. And I'm not sure whether we've figured out legally through town council. I don't think we've approached that, and that's a process to see if we are even able to do a mandate. But I have another question for Colleen. Do you happen to know, Colleen, if West Boylston has received any pushback in the few weeks, or maybe it's been a month, I don't know how long, that they enacted mandates on these maskings?
You know, I'm not entirely sure just in terms of what they've received for feedback since. I can certainly, and I'm happy to connect you with some of their board members or their Board of Health chair, if that's something
Sure.
that you would want to talk about. I can also connect you with the Shrewsbury Board of Health members as well. Like I said, they're discussing it tomorrow, so I don't know which way they're going to go.
Right.
But I'm happy to get you in touch with any of those Board of Health members to kind of see how it went in their community.
Yeah, that would be great, I think. And we'll wait till after tomorrow evening, I suppose, to see how that shakes out. But if you could send us a couple of contacts, that would be great.
Absolutely.
I would just add, I think to Dan's point, I think we're around like 20 new cases or 20 newly reported cases per week in town. I think in addition to the legal piece that we had talked about, trying to see if, we would engage with that. I think realistically, we need to also engage on what kind of an administrative support, which I'm sure would come at a cost to us in town. Because the current capacity that we have to really get the reporting in from businesses in particular, I think it's an exercise in futility if we don't have somebody to actually receive that information and follow up with that information, if it's just getting reported somewhere and left. So I think we probably need to also look at our administrative capacity if we are to take that on. And I don't know what kind of support we would get with the oversight piece about the masking. It's all well and good, I think, to say you have to do these things if there's no sort of regulatory backup to follow through and make sure people are actually doing those things at the same time. So.
Karen,
Yes, Bill.
I do think it might be appropriate to at least take the position that we encourage mask use in indoor areas without really mandating it. My observation is that about 30% or 40% of people are already really doing it, perhaps more than that. And I think it's certainly something which I think is potentially helpful. Certainly not as important as immunization. I do think that one of the issues going forward is what role natural immunity is going to play in COVID. You know, we're in a relatively high vaccinated state, and we've had a relatively high number of cases early on and not so much with the recent surge. And so I think there's going to be a significant number of people who have acquired immunity, really never had any symptomatic disease, so they're really not cognizant of it. But hopefully we'll get through this winter much more easily than we did last. There's been some discussion about, you know, peaks and valleys in this that happens somewhat spontaneously. I mean, certainly if in fact we had a much higher incidence, then I think you could argue the mandates would be more justifiable. I think right now it would probably not be well received, and I'm not sure it's absolutely necessary at this point.
Dan?
Yeah, thanks, Karen. And the other thought is, I know Worcester is struggling with the hospitalizations and the ICU beds. I think that's a complicated issue because of availability of other facilities, specifically one, and the manpower, womanpower to deal with it. We don't have access, I don't think, to hospitalizations in the town of Grafton. Maybe that's a HIPAA issue. Maybe it's too much to track. But you know, I honestly don't think of the 20 people in 1 week, I'm guessing, wildly guessing, that 1 or 2 might have been hospitalized. I don't know for sure, but I just don't think it's at that point in our immediate local sphere here to do a mandate at this time. That's just my opinion.
I guess the question, Karen, sorry, I guess the question is whether it would be appropriate to take the position of encouragement without mandating it. And I think that would be, you know, a reasonable, defensible sort of position to take.
All right. Do we want to see, after Colleen gets us the contacts in West Boylston and Shrewsbury, and someone's had a chance to speak with them, we regroup and see, and also obviously look at the data and everything, and then make a determination on how we want to proceed from there?
This is Dan. Yeah, I think that's a reasonable tact to take.
I agree. I don't see urgency at this moment to change.
Yeah, I agree. Do you guys want to try to set up a tentative meeting for 2 weeks or so from now?
Yeah, I can, either I'll send out something or see if Nancy can. Yeah. As I'm chuckling in her spare time. Probably better off if I could set and see what schedules look like. To see what we can do, because it'd be better than waiting a whole month, obviously. You know, normally we meet on a monthly basis. If we can find an available time that works in a couple weeks, at least by that point we'll know, you know, what's come out of whether Shrewsbury, what their decision was, and hopefully had time to speak with them, and then also get a chance to see, you know, where our case counts are going and how it seems to be panning out.
Right. Yeah, and it wouldn't have to be a long meeting. It would just have a couple of focuses. Okay.
All right. Well, thank you, everyone. All right, let me just jot that down before I jump on to the next topic. All right, so moving on to our next topic, which is Tripoli, West Nile, and ticks update. As Colleen mentioned, I thought the same thing last year, and I thought the same thing again this year, knock on wood still, because we're not out of the season yet, that it has been, compared to 2 seasons ago now, a much quieter season when it comes to mosquito-borne illnesses, especially, thankfully, of all of them, Tripoli. As of right now, Grafton's been notified of 2 mosquitoes in town that have tested positive for West Nile, not Tripoli. West Nile is what they've tested positive for. There's more information, a whole host of resources, including, I think something just got posted again today about prevention on our website. In the area that the mosquitoes have been found, spraying was conducted accordingly, as we're now part of the mosquito protection project. And just for everyone's reminder, so they don't have to necessarily go to the Board of Health page for mosquitoes, the thing to always remember is the 5 Ds. So dress in long sleeves and pants when possible, especially when you're in periods of mosquito activity, which are dawn and dusk is when they're most active. Then DEET is an effective repellent. Drain any water from containers that you have on your property in the area regularly. And then, as I mentioned, there's more information and tips available on our website. And then for ticks, because we also still are in tick season, use DEET or another effective repellent. And then a reminder to do a tick check on any person in your family who has been outside. Especially those hard to see areas, think the armpits, hairline, etc. And then if you do have pets, make sure you check them each time, when they've come in after being outdoors, because ticks don't just go on to humans, they also go on to pets. And that's an easy way for the ticks to get into the household also. So just a reminder for all of those areas. If there are any questions, board members on Tripoli, West Nile, or ticks? All right. Next topic is flu clinics and EDS. I did check with Nancy. Because I know there's a question on whether Grafton had pre-booked or not. Grafton did not pre-book any doses for this year. I do know that Karen Clark had reached out from the Alliance, had reached out to a contact at Walgreens to see if they could potentially run clinics, at least for maybe town employees. I don't know, Colleen, I haven't seen anything, but that doesn't mean there could have been emails that I wasn't copied on.
I haven't seen anything either. I actually talked to Pat today, and she hasn't heard anything. Karen was off the end of last week and today, so I made a note to touch base with her tomorrow to see if she ever heard back from the Walgreens contact, and if she didn't, if she can re-ping them, just so that we kind of get some closure to if that's possible to go that route or not. Pat also told me today that October 27th has been confirmed for Grafton High School and middle school. So that would be with the flu vaccine that's provided by Mass DPH. They made it so that there's enough for both the middle school and the high school, I think based off of previous year's numbers. And then once they utilize that, Pat will be able to order more from Mass DPH for the elementary schools.
All right, thank you. Dan?
Yeah, I just want to mention, thanks, that I think this year is a good year to go with the outside provider, say in this case Walgreens, for the service because of manpower issues, and so I just happen to agree that that's a good route to go this year instead of trying to do it with 2 or 3 nurses and some volunteers this particular year. And they do all the paperwork as far as I know. It's just a matter of the time, day, and place that they would do that. So that would be great, Colleen, if you could follow up with Karen, I think. Thank you.
Absolutely.
And I know after doing this for years and years, it seems now, like each year now that the CVS's and the Walgreens of the world, including then also doctors' offices, that they've kind of taken over the bulk of the flu shot administration. We've seen, I'm sure we could chart it out, like the amount of doses we gave to employees and then even to non-employees in town has dropped each year, an amount. I think, I forgot the exact numbers, but there was a very small, like a handful, we're talking, of non-employees in town who signed up for a flu shot last year. And then the employees was a bigger amount, but still, I think it was under 50 employees that signed up last year. So I know each year it's gotten less and less as we've been doing this, just because back in the day, you didn't have CVS and Walgreens with that much, we'll call it manpower and coordinated flu shot administration programs.
Just of note, if we do get them to get back to us, I just actually did one at my job location as well. They need at least a few weeks notice to plan. Even though they have more manpower, they're struggling with some of the same things that a lot of folks are right now. So if people could just be here just in general when they're waiting, if they're looking for a clinic to be hosted, it's just going to probably take a little while for them to get it on deck as well.
Agreed. All right. Any comments or questions on that as of right now, at least? Dan?
Just one thing on the EDS piece. Jamie Terry contacted me looking for an updated list of the call down or emergency contacts for town, and I think we need to get Jennifer's information to her. So I don't know, Jen, if you want to shoot your contact information to me, or I guess Nancy would have it anyway. So, but I can see that Jamie Terry has that information. Thanks.
This is Austin. Do you guys think we need to start thinking about scheduling the EDS drill for next year? So we reach out to them and maybe pick some tentative dates before they start filling up with the other towns? I mean, I know it snows a lot and they kind of get pushed off anyway, so we can start early.
Yeah, for the SNS drills, you can definitely reach out to Jamie and kind of get on the docket there. I don't know how it works, to be honest with you, being part of the Alliance, but if you were to do a vaccine clinic, whether it be a small vaccine clinic just for Grafton or a regional clinic with the Alliance, that does qualify for the SNS drill as well. And she would just do the AARIP for that.
Dan?
Yep. Yeah, I think that's something to consider. Thanks, Austin, for bringing that up. Last year, I think we were the last weekend of January, the very last possible spot to get it into this past the fiscal year. So watching the snow and the cold and everything. So I think that's a good idea. I think we ought to tackle it in the next couple of months if we can. So I'll talk to Jamie about that as well.
Okay, thank you.
Colleen?
Nothing on my end. Definitely Jamie, and then Pam and Shane would be your main points of contact to help coordinate and set that up for you.
All right. Sounds good. Yeah, the sooner we figure that out, the better. Just like Dan was saying, it was like tail end of it, and then you never know with the weather in the winter. So, all right. And then speaking of the winter, I figured, why only plan meetings out to the end of the year when you can start planning for early next year already? Especially since there's a couple Monday holidays in there. So we have the meetings planned out for this year, November 8th, December 6th, December 27th. So then I figured we might as well talk about January, February, and March of 22, as far away as that sounds. We're in October already. So January, we do have MLK Junior Day, which is a Monday on January 17th.
I was thinking maybe the 10th.
Yeah, that's what I was thinking, because December 27th is kind of more of our traditional, what we would always consider our signing of permits meeting. It's
Yeah.
kind of the extra meeting as such. So our normal meeting would be December 6th. So then, rather than necessarily doing it January 3rd, right after the holidays, everyone good instead of doing January 10th?
Yes, yep.
Will probably be absent from that one, but I think you guys can proceed anyways.
All right, so then if we do January 10th, then President's Day, which shouldn't cause an issue, in February.
Valentine's Day is the 14th, though.
Oh, not a federal building is closed holiday, but I didn't do that. All I was doing is looking for actual federal holidays that the town is not technically open on. That didn't come up. So if we did the 10th, 1, 2, 3, 4, technically we could do February 7th. We'd avoid President's Day and we'd avoid Valentine's Day.
Yep.
I'll vote for the 7th.
All right, then March. Do we do March 7th?
Yeah.
Sure.
All right. All right, so January 10th, February 7th, March 7th. All right. So those are the only topics we had on the agenda. Mail and correspondence, there was nothing beyond what we already talked about with like the monthly Alliance report and the inspection and all of that. Just I'll reiterate the upcoming at least 2021 meetings for everyone: November 8th, December 6th, December 27th. So that is it for topics and the agenda. There's a motion to close the meeting. Did we lose Dan?
Yep.
Oh, there he is.
Dan.
Like Dan's usually like, I'll make a motion.
I know, I disappeared for a bit. Yes, this is Dan Finn. I'd like to make a motion to close this meeting.
Is there a second?
This is Austin Magnan. I'll second that motion. And Pam and Shane, it was very nice to meet you both.
Yep.
Agree. All right, and then we'll do roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski-Govan, aye.